The following episode discusses sensitive subjects in hopes to encourage more empathy and transparency in the future. Viewer discretion is advised. New York Presbyterian Hospital, May 23, 2020. A doctor sits in her office looking over slides in a microscope. She's exhausted, working at combating the coronavirus for what feels like an eternity. She has some fresh theories, but in order to find workable results, clinical trials must be broad and include a wide range of individuals. So she puts out a call for volunteers, and a week later, testing is underway. However, she notices that her pool of people isn't diverse enough to gather accurate enough data for the study. Specifically, very few people of color are volunteering. And when she sends med students out to canvass the streets for African Americans, those willing to stop and talk all say the same thing: no. Dejected, the med students return to the hospital. "I don't understand," one says. "Why don't they trust us?" This episode is brought to you by the Child and Teen Checkups Program of Minnesota. We know there can be lots of barriers that keep you and your family from getting to a medical clinic, but they're here to help. And children up to age 21 may even qualify for free checkups. Learn more at u21checkups.com. While that opening was a dramatization, the difficulty of recruiting Black Americans for a variety of medical studies is very real, and for good reason. Specifically, the deep-rooted distrust some members of the African American community feel toward the medical establishment. And it's entwined with the regrettable history of people of color being exploited by American doctors and medical organizations, stretching back to when they were the most vulnerable: slavery. As far back as the 1800s, it was commonplace for medical schools that needed human bodies for medical research or anatomical training to steal them from slave cemeteries. Then once the bodies served their purpose, they were often dropped in the sewers or incinerated. However, these American doctors didn't restrict themselves to the dead. Bringing us to James Marion Sims, a man who would be crowned as the father of modern gynecology. Originally from Lancaster County, South Carolina, he returned to his hometown to start his career, but then relocated to Montgomery, Alabama in 1835 after his first two patients died. Due to the poor state of 19th century American medical training and education, he was able to open a practice after only about a year of education between the Medical College of Charleston and Philadelphia's Jefferson Medical College. And it was in Montgomery that Sims became famous for treating vaginal issues, an area the almost universally male medical field neglected at the time. He invented the vaginal speculum, the duckbill-shaped device that, paired with mirrors, aided in vaginal and pelvic exams. He also established a procedure for the treatment of an agonizing childbirth complication that left a tear between the uterus and the bladder, which, if left untreated, would cause the patient to leak urine, leading to poor hygiene and being shunned by society. But between 1846 and 1849, in order to perfect his surgical repair technique, Sims operated on at least 7 enslaved Black women without their consent, having only made various financial arrangements with their owners. And he actually operated on one of these poor women, a 17-year-old named Anarcha, 30 times. Because you see, for some reason, Sims and many other whites at the time didn't think Black people experienced pain to the same degree that white people did. And as a result, he operated without using anesthesia, which was not widely available at the time. And though it was commonplace to prescribe painkillers during recovery after surgery, that too was an option Sims did not take. But his callous behavior did not end there. Since he'd managed to establish himself in Montgomery as the go-to doctor for patching up injured slaves and getting them back in the fields, this left him with an endless supply of test subjects, which eventually led him to doing experiments on Black children. Attempting to find a treatment for a bacterial infection affecting newborns, Sims wrongfully concluded that it was caused by skull plates compacting in the birth canal. So he tried to cure newborns with experimental surgery by prying apart their skull plates with a shoemaker's tool. These surgeries had a 100% fatality rate, and he kept the dead children for dissection. It was often reported that it never occurred to Sims that he'd ever done anything wrong. Though as horrible as Sims was, he didn't withhold treatment in order to observe the long-term effects of a disease. That distinction falls to the United States government, which conducted the Tuskegee Syphilis Experiment from 1932 to 1972, which we already covered on our History of Syphilis series, but would be remiss if we didn't mention again here. But a separate injustice that occurred in 1927 was when the Supreme Court passed a eugenics law allowing for the sterilization of women without their permission if they were deemed morally or mentally unfit to procreate. A determination, you can imagine, often tainted by prejudice. Supposedly, this was to prevent society's defective members from being able to reproduce. At least 30 states took advantage of this and sterilized scores of women. But the worst offender by far was the state of North Carolina. Their eugenics board, established in 1933, approved at least 7,600 sterilizations for mostly poor black women. Many of those selected and forced into the procedures were children as young as 9. Another story of the medical industry taking advantage of people of color was that of Henrietta Lacks, a Baltimore-based mother of 5 who in 1951 suffered with pain and bleeding. She visited Johns Hopkins Hospital for treatment, and while the doctors treated her, they also harvested her cells for other means without her consent. Dr. George Otto Gay had been studying cervical cancer cells collected from various women over the years, but the cells he previously collected never lasted long enough for in-depth experimentation. That is, until he discovered Henrietta's cells were unusually long-lasting, so he gathered and exploited them without her knowledge. In the lab, Gay would name the cells after her, dubbing them HeLa cells, and they would become part of treatments for everything from Parkinson's disease to leukemia to Jonas Salk's polio vaccine, and Gay would go on to win 2 Nobel Prizes. Over the years, the list of HeLa cell studies have expanded to vaccines, cancer treatments, in vitro fertilization, a genome sequence, as well as studies on hormones and the effects of radiation exposure. In fact, as of 2018, there are 17,000 U.S. patents connected to Henrietta Lacks' HeLa cells. And while all of these breakthroughs were godsends to modern medicine, the children of Henrietta Lacks only became aware that their mother's cells were being used this way when researchers contacted the family and asked for more of them in 1973. This prompted them to seek ownership of their mother's exploited cells and to have a say on how they could be used. It wasn't until 2010 that Henrietta's enormous and invaluable contribution to medical science was finally recognized. So with terrifying and immoral stories like those we just discussed, and countless others like them, it's no wonder that present-day people of color remain skeptical of our medical system. And that skepticism in turn has been attributed for delaying treatment of conditions like diabetes, asthma, and heart disease until they've caused irreversible damage. In fact, statistically, African Americans are 3 times more likely to die from asthma as whites, 60% more likely to develop diabetes, and 40% more likely to have high blood pressure. And helping to keep these issues alive are facts like 50% of medical trainees that were polled in 2016 still believe a number of falsehoods concerning African Americans and pain. These included the idea that black people don't feel pain the same way as whites, that they have less sensitive nerve endings, or even thicker skin. And I know that might sound unbelievable in this day and age, so to learn more about it, you can look at the link we provided below. It's a sobering look at how deep people's biases truly run. This long history of racism in medicine, when coupled with the general neglect and high expense of American healthcare, has led to our communities of color being prone to distrust the medical industry, and therefore delay preventative care, which in turn leaves treatable conditions to run rampant through communities of color at higher rates because they're often diagnosed too late. The lack of trust between our medical industry and our communities of color has had a terrible impact on people already marginalized by society. For everyone's sake, trust has to be reestablished, and decency has to become the norm. And we think that starts by not only recognizing this painful legacy, but also being open about it and calling it out where remnants of it still exist. Also, simple checkups and screenings that could mean the difference between life and death would help bring those distressing stats we mentioned earlier under control. So while we confront our own biases, let's make sure we empower everyone to become advocates for themselves and others when it comes to healthcare. Because one of the best ways to break the cycle is to not only start getting the preventative care that you need, but also preventative care you can trust. Once again, thanks so much to Child and Teen Checkups Program of Minnesota for sponsoring this episode. As we just discussed, we know that there can be lots of barriers that keep you from getting to a health clinic, but that's where Child and Teen Checkups Program can help. They provide resources for low-income families to take charge of their own health, including things like transportation assistance and interpreters. Not to mention dental health is included in their programs. But best of all, kids may even qualify for free annual checkups. You can get started today and learn more at u21checkups.com. That's the letter U, 21checkups.com. A most legendary thanks to Ahmed Ziad Turk, Gunnar Clovis, Alicia Bramble, Kyle Murgatroyd, Casey Muscha, O'Reels1, and Dominic Valenciana for helping make this show possible.